Welcome to Summarize Science. Ever wonder how surgeons navigate the complexities of the human body during an operation like a hip replacement? They often use live X-ray imaging, but accurately pinpointing key anatomical landmarks on the pelvis can be incredibly tricky. Researchers are now developing AI to automatically find these points, but there's a big challenge they need to overcome. The problem is that most AI models are trained on perfect, straight-on images. But in a real operating room, the patient or the imaging equipment might be slightly tilted or rotated. This change in perspective can easily confuse the AI, leading to inaccurate measurements when precision is absolutely critical. To solve this, researchers came up with a clever new training method for their AI model, which is a type of network called a U-Net. They tested 3 different approaches, which you can see laid out in this diagram. The goal was to see which method would make the AI most robust to these changes in viewpoint. Instead of just showing the AI a flat 2D X-ray, they also gave it access to the patient's 3D CT scan, which shows the full 3D structure of the bone. This diagram shows the 8 specific landmarks on the pelvis the AI was tasked with finding. Giving the AI this 3D context is like giving it a blueprint, helping it learn the pelvis's true shape, not just its 2D shadow. The researchers put 3 AI training strategies to the test. The first was a baseline model trained the standard way on 2D images. The second tried to learn both the 2D image and the 3D positioning all at once from scratch. The third model was trained in 2 stages. First, it learned the basics from the 2D images, and then it was fine-tuned with the 3D information. So which one performed the best? This table shows the results, with lower numbers meaning less error and better accuracy. The U-Net fine-tuned model, which learned in 2 steps, was the clear winner, achieving the lowest error on both test datasets. Interestingly, the model that tried to learn everything at once from the start actually performed significantly worse, showing that the training strategy is crucial. You can see the difference visually here. The green dots are the correct locations, and the other colors are the AI's predictions. The predictions from the fine-tuned model in the right-hand column are consistently closer to the green ground truth dots. So, let's recap the important points. The key takeaway is that to make landmark finding AI more reliable, it's best to use a 2-stage training process. First, let the AI master the basics on 2D images, then fine-tune its understanding using 3D anatomical data. This sequential approach helps the AI build a more robust spatial understanding. What could this mean for the future? This research establishes a framework for creating more dependable AI assistants for the operating room, potentially improving surgical precision and patient outcomes. Thanks for watching Summarize Science.